A matter of great pleasure and honor for me to be here as a chief guest and preside over the 53rd Convocation of the College of Physicians and Surgeons of Pakistan. I wish to thank especially Professor Chaudhary and the CPSP Council for inviting me at the occasion and share my few thoughts with you. But first and foremost, like Professor Chaudhary, I would like to very cordially congratulate all the people sitting in robes around this conference center who have become fellows. I would like to congratulate them and their families, and especially their parents and spouses. Spouses, I know, have a very hard time, especially when you are post-graduating. So very special thanks to you and congratulations to you as well. Ladies and gentlemen, as Professor Chaudhary has very elaborately explained the role of the college in providing specialist health workforce to the country, I am indeed impressed by the huge contribution and the progress made by the college over the years. It is indeed one of those institutions in Pakistan that we can take pride in. It is bringing a great significance to the medical profession and the postgraduates from this college. I'm glad also to learn that the college qualifications have earned recognition both in developing and developing world. And I take this opportunity to commend the efforts of the CPSP Council for taking the college to such a distinguished position. But let me tell you, it may be difficult to establish an institution than to maintain the standard of excellence that it achieves. And hence, the sustainability of effort, diligence, application, and compliance to the highest levels of standards of medical education is extremely important. One of the signs of the maturity of any institution is also that it becomes self-sufficient. And as we have just learned, perhaps it is one of the few institutions about which you can say that the employees have no complaints. It is making good resources, and it is also managing those resources very well and spending them where these should be spent. As you know that this government has a very ambitious and long-awaited health reform agenda, which we are gradually implementing. Time and space does not allow me to go into the details of the whole agenda, but suffices to say that our vision is that of universal health coverage in the country, and our focus is on strengthening the primary health care. The structure of the healthcare in Pakistan is such that the healthcare, around 30% of it is located in the public sector, and around 70% of it is provided by the private sector. The out-of-pocket expenditures in Pakistan are ranging now to around about 60%. If we combine this with the poverty data in the country, around half of the population in Pakistan is living under the poverty line. So obviously, this brings huge difficulties in seeking health care by a majority of the people in Pakistan. Since majority of the health care is located in the private sector, it needs to be bought, purchased. So our health reform agenda has a laser focus on making healthcare accessible of acceptable minimum standards of quality to every citizen of Pakistan. And linchpin of any healthcare system is health professionals. And this is why in our health reform agenda, one of the health reforms have centered on resetting medical education and the medical curriculum and the standards of the medical health care in the country. And this is why Pakistan Medical Dental Council had to be dismantled after a lot of reflection, after a lot of thought, after a lot of analysis and study, and a new Pakistan Medical Commission has been established. One of the policy instruments of PMC is establishment of National Medical and Dental Academic Board, which is going to look at afresh the medical practice and the medical standards and the medical curriculums in the country. One of the driving force behind these decisions is a recognition, and a stark recognition, that especially our undergraduate medical curriculums are quite divorced from the medical or the healthcare situation in the country. If you allow me to elaborate a little bit, an average medical graduate in Pakistan has no idea that this country has more than 50% of its population struggling to have basic health care available to them, and what difficulties and obstacles, financial or otherwise, they have to go through to get their loved ones to be treated appropriately through the same healthcare system. A country which has highest prevalence of hepatitis C, a country which has fast accelerating epidemic of HIV/AIDS, a country which is fifth in terms of disease of burden of tuberculosis, a fourth in terms of burden of disease of tuberculosis, which is not treatable by available treatments, a country where we have to start typhoid conjugate vaccination because we we have started receiving extensively resistant cases of typhoid. A country which has one of the highest maternal mortality rates, and this tragic list goes on and on. The question that we have to ask ourselves is that are we training our medical graduates and postgraduates and equipping them with the knowledge to address these problems? And this is why I always maintain that our medical education system has to be reformed thoroughly. But linked with this is also another very important point. If we say that 70% of the healthcare is situated in the private sector, and if we also say that our focus is on the primary healthcare, then who provides primary healthcare in the private sector is a very interesting question. And these are general physicians, GPs. And I'm very glad that Professor Prafula Chaudhary mentioned the importance and the programs that they have initiated to loop in the general physicians in the country who, after doing their house jobs and getting licensure for practice, starts their practice with absolutely no training in family medicine. World Health Organization says that at least 3 family physicians are required for every 10,000 people in any country. The number of properly postgraduate family physicians in Pakistan is very limited. It is so abysmal that it is difficult to even mention. And at this rate of production of postgraduate family physicians in Pakistan, Pakistan will take more than 100 years to achieve 3 family physicians per 10,000 population. So of course, neither we can afford this time nor this is acceptable. So what do? We obviously have to have innovative approaches. And I'm very glad when I heard that CPSP is already administering a 100 hours CME program for general physicians. Through this forum, I would like to have partnership with CPSP, a government CPSP close partnership, where we go beyond these 100 hours and where we can develop maybe a 1-year diploma to upgrade and reset the general practice in Pakistan. While I was in World Health Organization, we started working on it. Because this problem is not limited to Pakistan. This problem is prevailing in most of the low and low middle income countries. And this kind of innovative actions are required if we are serious and sincere about upgrading our healthcare system. I'm also very pleased that some of the fellows are now also representing Australian Royal College of Medical Practitioners, medical physicians, and I think these kind of collaborations are the need of the hour in order to make meaningful difference in the actual health care which people are getting in this country. Another very important point, I'm sorry to dampen the celebrity mode that you are all sitting here, but for me, not to talk about the ground realities of healthcare, of which you are going to be very important stakeholders, you are, is very difficult. It is very difficult to be soft-spoken about the situation of the healthcare in Pakistan. And hence, all of us has to remind ourselves that what role we can play as institutions, as communities, as individuals, and as specialists. The last point that I want to make is that the bioethics part of medical practice. Having returned after 50 years to Pakistan and having seen things from close in last 6 months as a health minister, less said is better. The state of medical practice in Pakistan currently. I have such examples that I really don't want to spoil the environment, but I do want to focus on one point, that institute like College of Physicians and Surgeons in Pakistan has a tremendous responsibility to initiate explicit programs of education and training in bioethics for medical professionals. What is happening in the private medical practice in Pakistan is absolutely not acceptable. And we all have to bear this responsibility to right the wrongs. And I have tried to understand that what is the state of education in bioethics in Pakistan, and it is very minuscule. Except perhaps few courses. And I don't think so that there is any membership or fellowship program in CPSP on bioethics. We need trained people in bioethics, keeping in view the state of affairs in Pakistan at the moment. Ladies and gentlemen, sorry to dampen a little bit the mood of this conference, but these are our issues, and we cannot put our eyes blind to it. We have to accept the realities, and as you, as fellows of this college, as ambassadors of this college, will go back to your practices, it is absolutely very important that you carry all these perspectives that I have just pointed to, which you understand better than me, but I think it is very important that they become our priority. At the end, I would like to thank once again, I'm overwhelmed, honestly, with the privilege and the honor that I have been given to be a chief guest this morning. I'm thankful to the CPSP Council and Professor Jafrullah Chaudhry once again for providing me the opportunity to be part of this occasion, and I wish you best of luck in your future medical endeavors. Thank you very much.
We are really grateful for your very vigorous speech, and I can assure that the College of Physicians and Surgeons will stand with the government of Pakistan in providing the new fellowships or degrees which you have just mentioned, which are very important. As far as the tradition of the College of Physicians and Surgeons is concerned, CPSP awards gold medals to those trainees who have outstanding performance in their discipline. Professor Jafrullah Chaudhry Medal. This medal is awarded since May 2001. to a candidate who scores highest marks in FCPS Part 2 General Surgery, with the proviso that such marks are not less than 70% and all CPSP examinations have been passed in the first attempt. This model is awarded to Dr. Ramla Vadanfar. Dr. Ramla graduated from King Edward Medical University, Lahore in 2012, completed residency at the Rawalpindi Medical University, Holy Family Hospital under supervision of Dr. Usman Qureshi and passed final FCPA examination by scoring 74% marks. Highest marks in FCPS Part 2 Orthopedic Surgery with the proviso that such marks are not less than 70% and all CPSP examinations have been passed in the first attempt. This medal is awarded to Dr. Fasih Shahab. Dr. Fasih Shahab graduated from Khyber Medical University, Peshawar, completed residency at the Khyber Teaching Hospital under supervision of Professor Zahid Asghar and passed final FCPS examination by scoring 74% marks. The college is offering a membership program in health profession education to the fellows of the college and others holding equivalent qualifications. This year the diplomas awarded to 4 fellows. Number 1 is Dr. Asma Razak.
Yes, ma'am, Samudike. Thank you.
Thank you, sir.
Next is Dr. Hafizuddin.
Sir.
Camera side.
Dr. Sahibzada Nasir Mansoor.
सर यहाँ देखिए थैंक यू
डॉक्टर तहमीना आजाद
यस मैम थैंक यू
They are the leaders of the medical education. Now I request President College of Physician Surgeons Pakistan to present the college shield to the Honorable Chief Guest. Recognition of professional caliber and long-standing medical services. College awards honorary fellowships to distinguished international examiners and trainers. Dr. Amirul Haq to kindly come and give the citation.
Bismillahirrahmanirrahim. Ladies and gentlemen, it's my privilege and honor to present Dr. Amirul Haq Khan. And I have the honor to read the citation of Dr. Amirul Haq. Currently, he is working as a consultant surgeon at Manor Hospital, Walls Health since 1962. After graduation from Dow Medical University, he got trained in surgery in UK and acquired fellowship of College of Physician Surgeons, Edinburgh and England. He developed special interest in bariatric laparoscopic surgery and vascular surgery. Being an educational supervisor for under and postgraduate medical students, he held a number of academic positions, including Director PAF Hospital,
Islamabad, Medical Director, Walsall Healthcare Center. In recognition of his services, College of Physicians in Pakistan is honored to bestow him with fellowship in surgery. Ladies and gentlemen, let us welcome Dr. Amirul Haq.
By virtue of the powers vested in me as Director of the College of Physicians of Pakistan, under Section 9, Subsection 2, Clause H, read with the Rule 11.1, Sub-Rule 3 of the CPSP Act 1932, I admit you to the honorary fellowship of the College of Physicians and Surgeons of Pakistan, and in token thereof, I present you you the degree and author you to wear the robes ordained as the insignia.
कैमरा से सामने
I have the honor to read the citation of Dr. Abdul Zahir. Currently, he is working as consultant gastroenterologist at the AMCH at NAS General University Hospital, Dublin, Ireland. He graduated from Rawalpindi Medical College, got trained in medicine at St. James Hospital and Trinity College, Dublin. He became the member of Royal College of Physicians of United Kingdom and Ireland in 1998. He was awarded MD in gastroenterology in 2012 in recognition of his higher research. Mr. Zahir is actively involved in undergraduate and postgraduate teaching and MRCP clinical examinations. In recognition of his services, the College of Physicians and Surgeons Pakistan is honored to bestow him with the fellowship in medicine.
By virtue of the powers invested in me as President of the College of Physicians of Pakistan, under Section 9, Subsection 2, Clause H, read with the Rule 11.1, Sub-Rule 3 of CPSP Act 1962, Dr. Zahir, I admit you on the fellowship of the College of Physicians of Pakistan, and in token thereof, I present you the degree and authorize you where the robes ordained as the insignia of this.
Sir.
Third recipient, Dr. Ahmad Jamal. I request Major General Mazhar Ishaq, Controller of Examination, to read the citation of Dr. Ahmad Jamal.
Sir.
Good morning.
Sir.
I have the honor to read the citation of Dr. Ahmad Jamal. He completed his FRCS from the Royal College of Surgeons, Ireland in the year 2000 for the last 27 years in Ireland. Currently he is working as a consultant in emergency medicine, Ireland, and that is since 2007. He has got a special interest in leadership in emergency medicine. He is also associated with International Emergency Medicine Leadership Institute in Harvard Medical School, USA. He is also a member of the National Executive Council of the largest political party in Ireland, which is the government at the moment. He has been supervising trainees in emergency medicine for the last many years. In recognition of his services, the College of Physicians and Surgeons Pakistan is honored to bestow him with the fellowship in emergency medicine.
By virtue of powers vested in me as President of the College of Physicians and Surgeons of Pakistan, under Section 9, Subsection 2, Clause H, read with the Rule 11.1, Subsection 3 of the CPSP Act 1962. Mr. Ahmad Jamal, I admit you in the on the fellowship of the College of Physician Surgeons of Pakistan, and in token thereof, I present you the degree and also I wear the robe ordained as the insignia of
कैमरा सही
Now I start introduction of our performers. We start from anesthesiology, Dr. Ali Arslan Mir.
कैमरा सही
Dr. Fiza Badood.
मैम सामने देखिए।
Dr. Jay Kumar.
कैमरा
Dr. Aftab Ahmed. Now we start with cardiac surgery, Dr. Nasir Islam. Dr. Tariq Suhail Babar. After cardiac surgery is another specialty, important, most important, cardiology. We start with Dr. Azhar Ali Chaudhary. Dr. Fadhia Masood. Dr. Gohar Rahman. Dr. Hassan Shehzad. Dr. Javedullah Khan. Dr. Madhya Bhatt. Dr. Imran Zamir. Dr. Muhammad Abbas Khan. Dr. Muhammad Ijaz Ayub. Dr. Muhammad Zishan. Dr. Muhammad Zishan. Dr. Mujtaba Ahmed. Dr. Rafe Iqbal. Dr. Samra Rahmat. Dr. Waleed Ahmed.
Now the specialty of cardiothoracic anesthesia, Mohammad Adnan Akram. Chemical pathology, Afsha Bibi. The second recipient of chemical pathology, Mehreen Hassan.
हम सामने देखिए
Clinical cardiac electrophysiology, Zahoor Ahmed Khan. Clinical hematology, Mohammad Farhan. Community medicine, Sara Maroof. Shama Razak. Sumaira Masood. In the discipline of dermatology, Aisha Anwar. Farah Yusuf. Hina Zahoor. Mawid Ahmed. Maimuna Aslam.
मैम सामने देखिए
Nafila Shakib. Neelam Ayub. Saira Niazi.
थैंक यू
Sayyida Medet Fatima. Uruj Mirza. The discipline of diagnostic radiology, Adila Abid Bukhari.
कॉल कर दे कॉल मेरे नंबर पे कर
Aisha Butt.
जोन पे कर ले
मैम सामने देखिए
Aisha John. Ambari Kamal.
उसी के पास ले जाओगे फिर
अनीजा इकबाल, अस्मा असगर, आयशा फरीदी,
फ्लैश भिजवा देंगे
बीबी खुफसा,
अच्छा बताया
फारा सना,
मैम सामने देखिए।
इरम कैसर, खालिद शकील बाबर,
फ्लैश भिजवा देंगे
मारिया बतूल, मरियम मलिक,
सही रखो किसी ने नंबर भेज तू का दिया क्या
मुबशरा अजीज,
बुलाना पड़ा रिजर्व नहीं आया तो 15 से लेकर 10
मोहम्मद आमिर महमूद भट्ट, मोहम्मद नोमान मलिक,
इसको बुलाना। थैंक यू
सर।
मोहम्मद उस्मान, नसरीन यूसुफ, निदा इकबाल, रुस्तम असलम शाह, सादिया ताहिर, सना याकूब,
मेरे नंबर पे कॉल करो ना मेरे को फ्लैश कर देना
सहरिश शमरेज खान,
मारिया कर दो
शाइस्ता मुश्ताक,
सर
सिद्रा सईद,
सर
सोफिया शबीर,